Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode 163 of the podcast for January 25th, 2013. My guest today is Dr. Greg R. Johnson. He is the Chief Medical Officer at Parkview Health in Fort Wayne, Indiana. So we're going to be talking about his perspective on lean healthcare as a physician and a CMO, talking about how Parkview Health is using lean to cope with a really challenging environment. We're also going to be talking about Parkview's participation in the Healthcare Value Network, what they've learned through their participation by hosting what they call a Gemba visit, where other network members from across North America come and learn and share experiences. And we'll also talk about his views on how lean can be incorporated into physician practice, what they're doing to engage physicians and to encourage lean thinking within their health system. So if you want to see some show notes and links, you can go to leanblog.org/163. And to hear all past episodes and learn how to subscribe and get new episodes automatically sent to you, you can go to leanpodcast.org. Dr. Johnson, thanks for being a guest here on the podcast.
It's my pleasure. I appreciate the opportunity.
So I was wondering if we can start off and talk about how Parkview Health is using lean as a methodology and strategy to cope with this really challenging healthcare environment.
Sure. So we began our lean journey approximately 6-7 years ago. And in the beginning, our lean journey was really focused around, we were rather event-oriented, really had I would almost call a centralized model for our lean, where departments or sections could come to the continuous process improvement lean leaders, and they would go out and assist them in running an event like a rapid improvement event or do a value stream analysis, and our growth and our strategy as it relates to lean is to move it more to every person is functioning with a lean mentality, and we have about 8,200 and some odd coworkers across many different counties. So that's been a challenge. We are progressing along that quite well. I would say that how does it act? So coming to your question is how does using lean help us cope with the challenging environment, as you say, as it relates to cost and quality? Well, again, the lean mentality is if something is not providing value to the customer, and depending on who the customer is, whether it's the patient, the physician, the caregiver, whomever that is, if it's not providing value, then we should do all we can to eliminate it out of the process. So with our reimbursement being challenged and probably declining in the future, it makes it that much more important to eliminate that waste to provide a better value, a process that provides a better value. And that sounds like a simple statement. It's extremely complex, and also how it's helped us cope with this is that not only are the times challenging, but they're changing constantly. And one of the things that lean helps us with is the mentality of this continuous improvement. You don't get to a state and say, I have it, I got it, I'm where I need to be. It's that constant reassessment are the things that we're doing adding to the value to that process? I don't think our health system is different than many others in that often when we assess a current state, we find out that we're doing things because we've done them for some time, and it's really not adding value. And shining the light on the current state is one of the first steps, and one of the most telling when you talk about how lean is helping us cope with these with the challenging times. But to really summarize it in a simple sentence is that lean helps us remove waste, and there's a fair amount of waste in our healthcare system. And when I say our healthcare system, I'm talking nationally here. And it helps us eliminate that waste because it's not adding value and it's costly.
Mm-hmm. Right. So, operationally, you're right. There's certainly lots of opportunities to reduce waste. One of the challenges with health reform that people often ask about, and I'd be curious to hear your thoughts on, is, the idea of, value-based payment. How do you see the current environment or what you're expecting in the future? Do you expect better alignment about getting paid for value as opposed to being paid for activity? Does some of that waste include things like unnecessary tests or unnecessary anything if that's not well coordinated or adding value to the patient? What are you seeing out there?
Yeah, so there, again, with the value-based purchasing and all of the governmental strategies on how they're going to pay us for quote higher quality and lower cost, they're all out there. I would say that we actually base it. I would not be authentic if I said we're not concerned about that, because we are concerned about that. But more importantly is and let me take a little sidebar. So I come from a background. I'm a nephrologist, and I come from a background in nephrology and dialysis world back through the 1990s and early 2000s, where we improved the quality logarithmically and decreased our costs substantially simultaneously. And most of it was, we may not have called it lean thinking back then, but it was the standardization of care. It was the standardized workflows and those sorts of things. So how we do it here at Parkview Health, I would say, is that same mentality, is that we can, and we've shown where we can dramatically improve quality of care while reducing our costs. And some specific examples would be related to the standardization of care at the bedside. So take a simple thing as order sets, standardizing our order sets to where we are functioning off of one order set across the health system has really helped eliminate a lot of unnecessary care, as well as care that's going to deliver possibly the same quality, but at a higher cost. So you eliminate that higher cost. And I always want to stress, as we talk about this isn't about the lowest cost.
Right.
That's an important concept. It's about the best cost. And so with that being said, if I go back to my nephrology world, the dialysis world, we're really bringing that forward into Parkview Health. And it's not just me bringing this forward. This is our executive leadership across the health system. It isn't all about value-based purchasing. Mm-hmm. Now, again, I would be unauthentic if I said that doesn't mean anything to us, because it does, because there's dollars attached to it, and there is public reporting associated with that. But it has to be even on a bigger scale than 1 or 2% of our bottom line.
Right.
It has to be infused into everything we do, because if we do that, if we apply the lean principles and such, it's far trumps the amount of dollars at risk in value-based purchasing currently.
Okay, thanks. And I'd like maybe ask a follow-up question on the standardization of care, the standardized order sets. What role did you play as CMO or other clinical leaders play in kind of garnering support for the idea of this, assuming, and correct me if I'm wrong here, that your physicians mainly are not directly employed, that they have privileges to work in the hospital? I'm curious to hear about the process of getting people on board with that idea.
Sure. So first off, we do have a significant number of employed physicians. We have approximately 320 employed physicians. But on our, as you stated, on our medical staff, we have medical staff across the system that's it's approaching 1,000. So there are a lot of physicians who are not employed by our health system. And the order sets, really, to put that simplistic, is setting clear expectations. We also are blessed with the fact that we are in the throes of a Epic implementation, electronic health record. And so it is a bit hardwired on how many order sets we will be able to manage and resources applied to that. So I'd like to say, yeah, we were great at affecting all these behaviors, but really it was out of necessity because you don't have the resources to manage 8 different order sets for a normal newborn, besides the fact that we know evidence-based medicine and the standardization of the care trumps all of those. But it's also nice to fall back and say, well, we don't have the resources to do it within an electronic health record. So the combination of setting clear expectations with our providers and then having that collaboration through our service lines. So the service lines are really what owned the order sets. So if you had a congestive heart failure order set, that was owned by the cardiovascular service line. It was vetted through their medical content expert, and they were responsible for that collaboration within that service line to assure that they gave their, good stamp of approval to that order set. And then it would get turned over to IS, and IS would place that order set within electronic health record. So expectations, service line based, would probably be the 2 biggest points to that success.
Mm-hmm. Okay, and I wanted to ask a little bit as well about Parkview's participation in the Healthcare Value Network. I understand that you hosted a visit recently. I was wondering if you could talk a little bit about that process and what you shared with all those different visiting organizations, and if anything, what you gained from the process of having outsiders come in and take a look.
Well, if I could start with the last part of that.
Mm-hmm.
So what did we gain? What we gain is the feedback, and both appreciative as well as constructive feedback on how we were approaching our lean strategy. That was probably the biggest asset of having the Healthcare Value Network, having a GIMBA visit here. So the process of setting that, what kind of things did we demonstrate, or when we say they visited the GIMBA, where did they go, and would you like some more of the operational aspect of that visit?
Whatever you think the highlights are in terms of what people were seeing in terms of improvement work or other lean practices.
Yeah. So I'll talk about 2 things, 2 subsets of what the Healthcare Value Network experienced when they were here. One is the inpatient service line and how we use our daily or twice daily huddle boards for our inpatient medical nursing, and how those inpatient huddle boards were tied to the inpatient service line metric board, which is then tied to the enterprise strategies and metrics, and connecting those dots. I think we received a fair amount of appreciative feedback and positive feedback about that ability to connect the dot to the system strategies all the way to the bedside nurse. So that was one area that we spent a fair amount of time with the Healthcare Value Network in the GIMBA, looking at our huddle boards. And inpatient medical is not the only place that we use the huddle boards. It's the one that I'm most familiar with in our system. Mm-hmm. And then how that ties to the inpatient service line metric board and its outcomes, and connecting the dots to the system strategies. The other area that is near and dear to my heart that we spent a fair amount of time was what's called our Parkview Physician Leadership Institute. And seemed to be a fair amount of interest in how we were developing our physician leaders. And it's something that we've been informally doing for about approximately 4 years, but more on a formal basis for the past 2.5 years, where we actually have a curriculum that our physician leaders, well, first off, you have to be invited or nominated to go to it, and then our physician leaders are taken through a series of interactive facilitations and teachings that cover all the skill sets that, not all, let me take that back, that cover many of the skill sets that are required by physician leaders. And our premise there is that we will not ask a physician to partake in a leadership role or a leadership activity if he or she does not have the skill sets to do such. And it's our job to assure that the leaders do have those skill sets. And so that was the premise on how we began. But we cover things like personal leadership, accountability, crucial conversations, finance, change management. We do some things with quality data and discussing both publicly reported as well as clinical effectiveness data. And that runs over a 16-week period. And again, the Healthcare Value Network, when on their Denver visit, there was a lot of interest in our Leadership Development Institute. And how, coming back to kind of connect the dots for this discussion, when you talked about how is Lean helping us cope with some of the challenges and changes that are going on, one of the things that our physician leaders partake in, one of their sessions is on Lean. I found that many of our physician leaders, I won't say shied away from Lean, but it was more that they may not have understood it. And if they don't understand it, sometimes physicians aren't the quickest to admit that vulnerability that they don't understand something. So we really wanted to bring that Lean thinking, and that, even if it's just talking about the nomenclature and what's the premise of Lean, that's really helped our Lean leaders engage our physicians in the health system.
Well, and then I'm sure talk a little bit more about your role as a CMO, then about kind of helping set the stage that it's okay. Everyone's a novice with Lean at the beginning. That's okay. We'll bring people along. I mean, what sort of involvement do you have, either with the leadership development activity or one-on-one physicians? Can you have any stories of some of that concern, or how you brought people?
Sure. Yeah. The best story I can share with regards to physicians and Lean was something that I had aired on many times, and I won't say that I was a slow learner, but I may have been a slow observation. I may have been a little slow on my observation. So let's go back and let's think about a rapid improvement event, or another Lean event. It may take many hours. Sometimes we could have a 1 or 2 day or 3 day event, looking at a process, looking at current state, developing ideal state and steps to get there. And how I had recommended, and others had recommended, that we engage physicians would be, physicians' time. Now there's a little sarcasm in my voice here. Physicians' time is extremely valuable, so let's just have them come in. Let's get Dr. XY and maybe Z to come in from 2 to 3 o'clock on Wednesday, and we'll use them as consultants, and they'll come in and we can ask them. We'll kind of keep a parking lot of questions for our physician consultants, and when they come in, we'll barrage them with these questions, and we'll use their time real efficiently, and we'll get the information we know. And I can tell you that was as backwards of an approach as we should have had. And it dawned on me that we needed more engagement with our physicians, because they weren't buying in as owners of the process, or more specifically owners of the solutions. And I had to get over the idea that, physicians' time is so costly, we're taking him or her out of surgery, or we're taking him or her out of the clinic or the hospital. And when we have our Lean events now, we are conscientious of how of our physicians' time, but we do not. We recommend that our physicians partake from alpha to omega, from beginning to end. And what we've learned is that the payoff, because the physicians are engaged both in the process as well as the solutions in the future state, that the likelihood that that's, number one, successful, but number two, sustainable, goes up dramatically. Mm-hmm. And in the same time, I won't say every physician, but many physicians begin to take on a new appreciation for process improvement. And then they begin to use their eyes and say, well, we used the lean tools in this. How come can we apply those same types of tools in another area? So it was a good way of garnishing support for continuous process improvement with the lean tools. But I'd say even more importantly, the success and sustainability of the future state was much, much higher when we said, look, we'd like you to be there for the full 2 days. We've even had some that were 4-day events, and it seemed like a lot, and there was some skepticism at the beginning, mm-hmm. but when we began to see the returns, it was probably one of my biggest success stories as it relates to physicians' engagement in lean.
Sure, and I assume your goal would be similar to what you touched on earlier, of not just having physicians involved in events, but having them demonstrating lean thinking, lean behaviors each and every day?
Absolutely. In fact, part of going back to the Physician Leadership Institute, our lean leaders here have developed they've changed the name on this a couple times, so bear with me. It's essentially a lean lab, hands-on. I think there's 8 or 9 stations that go through some different lean principles, and within our Physician Leadership Institute, they go through those. I call them apprentice lab for lean.
Mm-hmm. And through that, do they get to? Does this include like role playing and in terms of improvement activity, or what types of things do they get to practice in that lab?
Sure. So things like simple things as simple as 5S. Mm-hmm. From they'll talk about level loading. We'll talk about some of the simple lean concepts with regards to mapping out an ideal state. How to map out processes. So it's very basic, but it's also very rewarding because it begins to have them think about it in a different light.
And do you find a little bit of practice, does that move them far enough along where they don't feel as uncomfortable about being such a novice? Or how much activity or experience, if you can generalize, does it take?
Sure. That's a good question, and I would say that we've answered that. I probably have not answered that formally, but informally. And what we try to do is to assure that they go through the apprentice labs, and then the first event that they're involved in, we kind of pair up a lean leader with that physician to kind of be his or her, I don't want to call it a coach, but kind of a mentor for that, so they feel comfortable that they have somebody they can lean on and ask questions to, and that lean leader really helps that physician through the first event. And then it depends on the physician. If some physicians, this isn't their cup of tea. I can say that that's not common, because when they see the power of how it can help them solve problems and improve processes, most physicians become huge advocates of it and really want to partake in it. And then so after the first event, it's really kind of physician dependent on how close we pair a lean leader with them.
Mm-hmm. Well, great, and we're running short on time, but just want to ask Greg, do you have any other kind of final key lessons learned or other advice you would give, let's say, either for fellow CMOs or other healthcare leaders in general?
Well, if I could just reiterate a couple of things I think we've touched on. Is number one is assure the time for physician involvement. That's big, and that we shouldn't discount that, and we shouldn't discount the fact that better because the physician is there, that the physician becomes a champion of the process improvement.
Mm-hmm.
The second is kind of a parallel, but we shouldn't ask our physician leaders to do things that they don't have the skill sets to do. Again, I mentioned crucial conversations. That always comes to mind often. We often ask our docs to have a crucial conversation with a colleague, and yet we've never really trained a physician in that. We often make the assumption that if they're great clinicians and providers of medical care, that'll translate to the leader side of things, and that doesn't always hold true. Those are probably my two biggest take-home points.
Okay, well, great. Well, thanks so much for sharing some of your experiences and what you're working on there at Parkview Health. Again, our guest has been Dr. Greg Johnson, Chief Medical Officer at Parkview Health in Fort Wayne, Indiana. Thanks again for chatting today.
Thank you, Mark.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.